What happens during menopause is you get a decrease of both of these hormones. So you get this major drop in progesterone. But if you look at the relative ratio of estrogen to progesterone, it's going to make it appear that estrogen is actually dominant or too high, when in fact you actually have an estrogen deficiency along with a progesterone deficiency, but progesterone is dropped more severely. So some of the symptoms that you may experience pre-menopause and post-menopause would be hot flashes, breast atrophy, vaginal dryness, and no periods. Now, of course, when you reach menopause, which is supposed to be at age 52, this period is supposed to go away.
Menopause is that time in a woman's life that marks the end of her menstrual cycle as a result of a natural decline in her reproductive hormones. It is associated with the absence of 12 months of menstrual period. Menopause is a natural biological process. It can happen during the early 40s or late 50s. About 1% of women begin menopause before 40, and about 5% between the ages of 40 and 45. Menopause process does not occur overnight, but rather is a gradual process. This process is called perimenopausal transition. The perimenopausal period is the time around a menopause. The perimenopausal transition varies among different women. The perimenopausal transition mostly begins about 4 years before the last period. A small number of women starts their perimenopausal transition 10 years before
they'll be able to do a full evaluation of the vagina and the uterus. The most concerning thing about postmenopausal bleeding would be endometrial cancer, and that's probably going to be about 1 in 10 people.
The most common cause is what's called vaginal or uterine atrophy.
In the postmenopausal state, your estrogen levels drop, and the lining tissues of all those structures get very thin, and just touching them and rubbing together or any small use to it can make it'll get irritated and bleed.
Fortunately, doctors at Roper St. Francis can offer simple and effective treatments.
You need to supplement with a little bit of estrogen, and you can usually do that if it's a vaginal issue, just with some vaginal cream.
Many other causes can also be treated on an outpatient basis.
Some of the other more common ones that we see are all benign things usually. So you can have little polyps or growths in your uterus. You can have fibroids left over from before you were menopausal. And if it's a growth or something that needs to be removed, it needs to be removed from the uterus. That can usually be done with a vaginal procedure as sort of an outpatient surgery.
Okay, so let's look at this from both a physiological point of view and from a psycho-emotional point of view. From a physiological point of view, the Chiang Mai treats qi counterflow. That is the ultimate definition of the hot flash, right? Hot flashes are qi counterflow. They're a big expression of qi counterflow. So we can use the Chiang Mai to take qi that is rising up with the heat and bring it back down where it ought to be. The Chiang Mai treats internal urgency. So the classic definition of that in your textbooks is running piglet, right? That sense of having a herd of piglets running up your chest, this sort of bubbling sense of things, this sense of urgency rising from the gut into the chest. It's a